This video will guide you through the CHEETAH patient pathway along with the trial-specific documents associated with each of those steps. Here is a reminder of some of the key points from the introduction slide set. You must include all consecutive patients undergoing an abdominal incision greater than or equal to 5 centimetres, whose surgery was clean contaminated or dirty, and you exclude all caesarean sections. CHEETAH, if you remember, is a cluster randomised trial. The randomisation in the CHEETAH trial is at the level of the hospital and not the patient, and therefore individual patient level consent for exposure to the intervention or to current routine hospital practice, depending on your randomisation, will not be taken, i.e. there will be no preoperative consent. It would in fact be unethical to seek consent from patients preoperatively, as the patient will have no choice in terms of the theatre procedure itself, and this will occur at the hospital level, and therefore there really is no element of choice for the individual patient. Consent for surgery should be as per your normal standard hospital practice, but consent for CHEETAH is consent for the collection of the 30-day follow-up data, and should be sought post-operatively, either via verbal consent during the 30-day follow-up call, or via written consent during clinic follow-up. This process has been demonstrated in cluster randomised trials before, one of the most famous of which is the original assessment of the WHO Surgical Safety Checklist, which was published in the New England Journal of Medicine and is highlighted here on this slide. So this is the complete pathway of a patient in the CHEETAH trial, along with the trial-specific paperwork to accompany each of those steps. And we're going to talk through each stage one by one. Essentially, the reason for the creation of the patient pathway, it's been designed for several reasons. Number one, it's been designed to minimise the risk of losing any data, particularly from those patients presenting in the evening or over a weekend. Secondly, it's to help to ensure we collect the intraoperative data. And thirdly, the patient pathway was designed to try to minimise selection bias. So the first step in the patient pathway, following on from the operation itself, is the CHEETAH operation sticker. Ideally, the sticker should be completed in theatre, either during or just post-surgery, as there's a risk this data will be missed or you'll be unable to get this information if not completed at the time of the operation. And once completed, the sticker should be affixed to the hospital operation notes. Essentially, it's the information on this sticker that will allow you to determine if the patient is eligible to be registered into CHEETAH. So please complete for all abdominal surgical cases. Next, we have a short video to demonstrate the completion of the operation sticker.
Now we will look at how to complete the CHEETAH operation sticker. The operation has finished and the operation surgeon is checking their typed printed note. He or she will then find space to place the sticker onto that operation note. At this stage, the operating surgeon will complete the tick boxes on the sticker. The operating surgeon now completes the CHEETAH operation sticker by working down the individual components. Was a WHO surgical safety checklist used? Yes, it was. Was intraoperative pulse oximetry used? It was. Were pre-incision prophylactic antibiotics given within 60 minutes of the incision? They were, and augmentin was used. Hair removal at the site of the wound was performed in theatre using an electric clipper. The largest abdominal incision was greater than 5 centimetres. The actual intraoperative contamination was dirty, as this was a perforated large bowel. The last two questions relate to changing of gloves before closing the abdominal wound, and then changing of instruments before closing the abdominal wound. Irrespective of whether you are in an intervention or control centre, you should tick yes or no based on what actually happened during that specific operation.
The next step in the patient pathway is completion of the CHEETAH register. The CHEETAH register is essentially a log of all abdominal operations performed in the CHEETAH theatres that you have selected. The registers will be supplied to sites from the BC2U trials team in a bound booklet format of 100 or so pages. Using your standard theatre logbook, each morning the research nurse or a member of the research team should attend the CHEETAH theatres and transcribe every potentially eligible patient, i.e. all abdominal surgical cases, performed the previous day from the theatre logbook to the CHEETAH register and complete the first 6 columns as highlighted here. So you should enter the patient's name, the date and time of the operation, the patient's date of birth, sex, and the name of the abdominal operation. And most importantly, the post-operative ward for each of those patients to enable the research team to identify the correct patient on the ward. So the remainder of the CHEETAH register should be completed on the post-operative ward itself. So, using the CHEETAH register, the research nurse or the member of the research team should select the hospital and operation notes of each of those patients listed on the register and complete the next 4 columns. You complete those columns from the information that's detailed on the CHEETAH operation sticker that was affixed to the hospital or the operation notes during theatre. Using the sticker information, answer the following questions. 1. Was there at least one abdominal incision greater than or equal to 5 centimetres? And tick yes or no. Was the actual intraoperative contamination a clean contaminated, or dirty operation? And is the patient age appropriate according to your local ethics approval? So again, from the patient's date of birth on the register, does the patient meet the criteria? And answer yes or no. If the answer to all of these 3 questions is yes, then the patient is eligible for CHEETAH, and this should be recorded in the eligible to participate in the CHEETAH trial column by ticking yes. A CHEETAH trial number sticker should also be affixed to the final column on this register, but we will cover this in more detail later in the presentation when we talk through the trial number stickers and the CRFs. Conversely, if the answer to any of these questions is no, then the patient is not eligible to participate in the CHEETAH trial, and this should be recorded in that final column, eligible to participate in the CHEETAH trial column by ticking no. Next, we have a short video to demonstrate the completion of the CHEETAH register on the post-operative ward.
The research nurse is now going to the ward to check the patient's eligibility against the notes. He's using the register to identify the right patient, and once he's found the notes, he will take out the operating note, which has the CHEETAH sticker on it. He will transcribe the information from the sticker into the CHEETAH register. If the patient is eligible, he will then tick the eligibility box in the green part of the CHEETAH register. Now that the patient is eligible, he will add the trial sticker number onto the register and replace the operation note into the patient's notes.
To help you keep track of all patients registered into the CHEETAH trial, and importantly to help you manage the 30-day follow-up appointments, sites will be provided with a CHEETAH patient identification log. The log should be maintained at your site and not sent to the hub or to BCTU as it contains patient identifiable data. This log is essentially to help you document and manage your patients at your site. So moving on to the trial number stickers and the case report forms, or the CRFs. From the information on the CHEETAH operation sticker and the information that you've gathered on the CHEETAH register, you've established the patient is eligible for CHEETAH and the patient can therefore be registered into the trial. The patient is registered in a number of steps which we'll talk through in more detail. Firstly, select the next set of CHEETAH trial number stickers. There should be one sheet of unique numbers per patient, so one single sheet of the same number per patient. Affix a trial number sticker to the CHEETAH register. If you remember, there's a final column on the CHEETAH register for the patient trial number sticker. Select a CRF booklet and affix a trial number sticker to each page of the CRF booklet in the spaces provided. The trial number stickers can be used as you wish, so you can use them on the hospital notes maybe to help you identify patients as CHEETAH trial patients. And remember, any remaining stickers can be filed in your patient CRF or should be destroyed, but not used for any other patient. The CHEETAH trial number is a unique ID number per patient. Moving on to the CRF booklets. So the booklets have been designed to be as simple as possible and not to be overburdensome in terms of data collection at your site. So we're therefore collecting only the key data to enable us to answer the research questions. The CRFs come in two formats, an adult and a paediatric booklet. The only difference between the two is the contact details page, which is the first page in the CRF booklets. Obviously, there are some additional questions regarding parent, guardian contacts, for example, in the paediatric booklet, but that really is the only difference between those two. Importantly, the trials team at BCTU don't ever see this contact form. This is confidential patient data. The form is merely for your sites to hold contact details to allow you to be able to contact patients. There are also different CRF booklets according to the type of patient consent you plan to seek, i.e. written or verbal consent, and this is highlighted in the footer of each of these booklets. The only difference between these two booklets is the 30-day follow-up CRF, and these can be switched at 30 days as and when required. To allow for this possibility, single standalone 30-day follow-up CRF pages will also be provided. Paper CRFs must be completed in addition to the patient hospital notes. The hospital notes will be the source data for all patients, and this should match what is recorded on the CRFs. The CRF should be separated into patient-specific CHEETAH files and ideally stored separately to the patient hospital records. So this is the baseline and intraoperative CRF. Ideally, this should be completed as soon as possible following the selection of the trial number stickers and starting the CRF booklet. So using the information from the patient's hospital notes and from the information that was detailed on the operation sticker, complete the CRF to capture the data on the baseline SSI prevention practices, i.e. some of the specific elements of the WHO surgical safety checklist. Next, we have a short video to demonstrate starting the CHEETAH case report forms.
Now that the register has been completed, the research nurse will start a case report form pack for each eligible patient. So for the first patient, he is taking the trial number stickers and inserting them onto the front page of the case report form pack. And at this stage, he will now complete the CHEETAH patient contact form and the CHEETAH baseline and interoperative form. Once these are complete, he will return the operation notes back into the patient notes and replace the notes in their right place. And then he will take the case report form pack back to the CHEETAH trial office.
The final step in registering a patient into the CHEETAH trial is to add a new patient by clicking View/Edit Records on the left-hand side of the landing page of the CHEETAH REDCap trial database. The CHEETAH trial database is managed by the trials team at BCTU, and REDCap accounts will be issued during the site setup phase. The next video will talk you through follow-up of a CHEETAH patient.